Good day, everyone. I am Harry, your moderator for this webinar on the behalf of the organizer company called Conference Panel. I welcome everyone for today's webinar, which is called Emailing, Texting, and the Use of Personal Devices by Healthcare Professionals. So now, I would like to introduce our presenter for today. It's Mark Brangelman. Mark Brangelman is an experienced attorney in administrative and professional license law, representing a wide variety of professional clients from licensed individual healthcare professionals to licensed healthcare facilities and many others. As a frequent participant in continuing education, Mark has been a presenter for over 30 national and state organizations and private companies as the Kentucky Bar Association, Kentucky Office of Attorney General, National Attorney General Training and Research Institute, and Federation of Association of Regulatory Boards. So now I would like to hand over the floor back to our speaker. Over to you, Mr. Mark.
This is Mark Brangelman, and welcome to Conference Panel. This is Emailing, Texting, and the Use of Personal Devices by Healthcare Professionals, HIPAA and Privacy Myths versus Reality. So welcome to our 1-hour webinar. Based on the content of the program, we want to be able to identify some of the basics of HIPAA privacy because it's always helpful to go back to the basics. It's important to know what our parameters are and what it does and does not cover. It does provide a broad overview of HIPAA confidentiality issues and electronic communications on emailing and the use of those personal devices. It can't cover everything about HIPAA. It educates the person attending to ask the right questions in their own state, in their own healthcare entity, and in their own profession about compliance with HIPAA confidentiality and the use of electronic communications. So some basics of HIPAA privacy. HIPAA was effective and applied to healthcare providers who submit payment for electronic means. It requires protected health information to be defined and applies to covered entities. Remember, as a general definition, protected health information is any information held by a covered entity that concerns the health status of healthcare or the payment for healthcare that can be linked to an individual. Healthcare professionals and their patients communicate among themselves and with each other and with patients and client directly. It's unique as a confidentiality matter to healthcare as opposed to the general public because there is confidentiality of communications as an issue for all healthcare practitioners. You have to be very careful when you talk over the phone or that you use secure email or texting. So remember, there is private information and there is confidential information and there is protected information. You have a confidentiality issue, and patient medical records contain such a wealth of information: home address, home phone number, date of birth, social security number, everything you could need to fake someone's ID and commit identity theft. So state licensure boards take an interest in patient confidentiality, especially in mental health fields. So why use texting and email? As reported in the media, 5 ways home healthcare providers. So emailing and texting can be used to coordinate with caregivers' hours and locations, share information about patients that families want to have shared. Moving right along now, why use texting and email? It's the preferred communication method for so many young people. But remember, there are dangers apart from HIPAA confidentiality. So how best can you use texting and email? You have to identify and use a secure communications platform. You have to conform to the workflow and practice of the healthcare professional, as I've stated. It's just that many users prefer text and social media to even a phone call. There are HIPAA privacy and security rules that mandate the covered entities use safeguards. You have to secure the transmission to use those encrypted email systems or secure patient portals with a secure 2-factor identification sometimes and security login. Texting can be an acceptable method of communication between patients and healthcare providers. The same data security rules and practices apply to texting. You have to secure the transmission, use encrypted texting systems. Remember, HIPAA does not apply to patients. It applies to covered entity. So should patient communications be included in the medical record? So be careful about what you keep in the medical record with regard to things like telehealth, telepractice, and telepsychology. So what about telepractice affects what you should charge as a fee? An overview is applied to common sense suggestions on emailing and texting. Those kinds of policies should apply to the entire workforce, not just the nurse, not just the doctor, not only healthcare practitioners, but anyone communicating with a patient. That you have a single individual named by title who is responsible for overseeing electronic communications policy. Have your interdisciplinary team review your use of electronic devices. So an overview of HIPAA violations with an emphasis on state licensure laws. Know that these kinds of emailing and texting misuses get the attention of state licensure boards and agencies, and that violations of confidentiality, especially in mental health, are not taken kindly. As a bonus, we are coming up now on 60 Minutes. Look at the kinds of disclaimers that a website would have for its privacy exceptions, like on a Contact Me part of the web page. And here are general disclaimers that can be used, because I don't know that a general business's website, even if it's a medical office, a dental office, that has a Contact Me thing would be secure under HIPAA. I don't think that's what internet service providers typically provide. Informing the client about limitations of emailing and texting as a technology, risks of confidentiality information, how and when you will respond to email messages and such like that. So some takeaways in conclusion: cover the essentials that you need in your HIPAA policy concerning smartphone use and the use of personal cell phones for business. So data sharing, updates for 2022. So I hope we've covered today in about an hour and 2 minutes, basics of HIPAA privacy, the use of electronic communications. We've referenced state licensure laws. We've flagged privacy notices. We've talked about the importance of using HIPAA-compliant and secure texting and email with personal devices. We've looked at a bonus of website confidentiality and privacy disclaimers for use on a healthcare practitioner like a medical office. Thank you all. Over and out. Goodbye now.